The broadcast is now starting. All attendees are in listen-only mode.
Hello and welcome to the VDEC webinar series, and tonight's topic is on home care. I'm Dr. David Clark, a registered specialist in veterinary dentistry and run a referral clinic in Melbourne in Australia. So tonight I'd like to talk about home care as it pertains to the oral cavity and periodontal disease. So periodontal disease, as you're well aware, is one of the most common diseases we see in our pets that come into the veterinary clinic, and it's initiated and fueled by bacteria and plaque, and in particular the plaque biofilm. And the idea of our dental home care program and the concept of the home care program is to get clients and their pets working together within the veterinary clinic and at home in order to reduce the plaque, in order to improve the oral health of the pet. So tonight, what I'm going to talk about during this webinar is the aims of a dental home care program as it pertains to both the veterinary clinic, also the client and also the pet. We're also going to talk about and discuss how to choose a product and which products are available. And there's quite a number on the market, as you'd be well and truly aware. I'd also like to look at some of the benefits of each of these products and also how they work and some of the claims that the products and the companies that produce them also make. And I'd like to also talk about introducing a home care program into your clinic and the various stages that we might think about introducing dental home care. So that would range from introducing home care to puppies and kittens when they first come into the clinic to older pets that already have established periodontal disease and how we're going to maintain their oral health. And we'll also look at, I've recorded 2 videos with one of our nurses on introducing brushing, which you're more than welcome to utilize in your clinics as well. So initially, we need to work out what a dental home care program really is. Well, I've just defined it as really being a well-formulated and designed plan that's really designed to focus on plaque. And what we're aiming to do with this program is to decrease or prevent or remove the plaque that's accumulating on our pet's teeth. Ideally, if we can prevent it from actually attaching to the pet's tooth, that would be the perfect scenario. If we can't prevent it, then the next step to consider would be how do we actually decrease the amount of plaque that accumulates on the tooth surface. And if we can't decrease it, then obviously we'll need to think about how we can actually remove the plaque. And these 3 ways of reducing plaque are all designed to be done at home by the client and the pet, and not in the veterinary surgery under a general anaesthetic. So really we're talking about ways to avoid anaesthesia and teeth cleaning, obviously. We also need to consider the pet and the owner's capability and maybe their dexterity. We want to talk about and we want to look at the actual pet and just see whether they're actually able to handle a certain product, which products would actually suit that particular pet. And also, what's the owner's capability? Are they time constrained? Are they manually dexterous? Do they have sight issues, for example? Are they actually able to use the products that you're recommending and trying to get that particular client and pet to utilize? And then last is the aim really is to maintain a healthy oral cavity, therefore preventing future systemic disease by decreasing gingivitis, periodontitis, and therefore periodontal disease. So when should it start? Well, ideally we try and start ours in the clinic, and I would recommend that you start yours in your clinics as well when the puppy or the kitten first comes into the clinic. It's much easier to start a younger animal than an older animal, and also if you've got deciduous teeth, the client can practice by trying to brush or clean the deciduous teeth once they've erupted, so that by the time the permanent teeth actually erupt, then they'll be well on the way to keeping the plaque off off the teeth. If you don't have the opportunity to commence a home care program as a puppy or a kitten, then you could start it as an adult dog. I would advise that these pets, dogs and cats, come in and have their mouth assessed by one of your trained nurses, one of the veterinarians, before they start a home care program. And if that's not the case and they've already got established disease, then they certainly should start some form of dental home care after you've cleaned their teeth and assessed their oral health. So what's the aim? Well, I think the aim really is to reduce periodontal disease. That's our ultimate goal. And we do this by preventing plaque attaching to the tooth and obviously the gingiva. As I said before, we're trying to slow down the rate of plaque adhering to the tooth and obviously the gingiva as well. The aim also is to mechanically remove any plaque that's already attached to the teeth. Plaque takes around 48 to 72 hours to start mineralizing into calculus. So if the client is able to do some form of home care, every day is perfect, but every second day is satisfactory, and every third day they might just get away with it. So we need to try and prevent the plaque from actually mineralizing into calculus, because once it forms that hard calculus, then the animal would need to come into the clinic for an anesthesia and obviously to have their teeth cleaned. And then the most important thing is to individualize the program that works for both the patient as well as the owner. So we do this in our clinic by relying on 4 different factors. The first one is we rely on the client to administer the product. So therefore we need to choose a product that the client is happy with, the client believes in, and also the client is actually able to administer. We also have to look at the particular pet. It's much harder to deal with, say, an older cat than it is with a younger dog, for example. So we need to look at the particular pet and just see whether they're going to accept the product. For example, a food might be much easier in maybe an older pet, or a pet that maybe wants to bite or is maybe less tolerant of, say, a toothbrush, for example. We also need to rely on the veterinary clinic. Ideally, we have the nurses and the vets all motivated and are able to monitor the success rate of the program. And also, we need a product that works in the situation that we're actually aiming for it to work in as well. So how do we choose a product, and which products are the best to pick, for example? Well, there's obviously many ways to choose a product. We could choose it on price, for example. We could choose it on a recommendation from a friend. We could choose it on a recommendation of a drug rep or a production company that actually makes it. So they all are a little bit biased. There's 2 ways you can get some independent advice. The first way is to use the Veterinary Oral Health Council website. They accept, or they give various products seals, a bit like the what we call the ADA seal. For example, the toothpastes might get the Australian Dental Association seal, and we do the same thing with the VOHC. So we'll talk about the VOHC in a minute. Another way to look at various products is to have a look and see how many articles have been published on these articles. They're normally published in maybe some of the human journals or the Journal of Veterinary Dentistry as well. The Journal of Veterinary Dentistry is put out by the American Veterinary Dental Society, and it's a peer-reviewed journal. So therefore, a product that actually appears in that journal has been tested and also judged by their peers, our peers. The VOHC website, the Veterinary Oral Healthcare website, is a worldwide recognized symbol of approval. This is an organization that's based in the United States, in Philadelphia. It's run by an independent board under the direction of the American Veterinary Dental College. The American Veterinary Dental College is the group of boarded specialists, of which I am one, and we have the VOHC, which is an independent group. And what a company does is, to get the VOHC approval, or to be accepted by the VOHC, is to run 2 research studies, 2 separate research studies on the product, either using different cohorts of animals and at different times. And they can either apply for a standard or in a reduction of plaque, or they can apply as a standard in reduction in calculus or tartar, or they may apply for both. If they can show in the independent studies, and it's accepted by VOHC, that their research and their protocols actually show this, then they're awarded the VOHC seal. So therefore, that particular product has been independently evaluated by the VOHC, and the person who's then purchasing the product, or the veterinary clinic that's recommending that product, can say, well, this particular food or this particular gel, for example, is independently assessed, and it actually does reduce plaque, or it actually does reduce calculus. So this is another way of having a look at products and working out an independent review. There is a list. If you go onto vohc.org, there's a very long list of all the products, keeping in mind that not all products are available in all countries, but this is just a screenshot that I pulled off of the first ones, and you'll see, for example, that Hills were the first company, and they produced the TD biscuit, or the TD kibble, and that got VOHC approval back in 1998, both for plaque and calculus, or tartar, because clients will look at the website as well. So as they know, calculus is tartar, so they can see that TD has been approved in both the canine and the feline form as well. So Friskies treats have also been approved. You've also got Science diets, IAMS and Eukanuba. Since then, Royal Canin have also had a VOHC approval as well, and there's many more, and we'll go through some of these products now as well. The other way to assess a product is to look at what's been published as well. Are there clinical papers to support what's been published? What level of evidence is available as well? There was a paper written by Philip Rougeborch and Alan Logan and Fraser Hale, who are veterinarians, and they published that in the Journal of Veterinary Dentistry as well. And what that did, it was actually looked at evidence-based veterinary dentistry and products. And they looked at each product and actually gave it a score between 1 and 4 based on the level of evidence that was available through published data, and also through the VOHC as well. So this is quite a good paper to pull up. I'll see if I can get this and see if it's available, and see if we can put this on the website for you all as well. But if you can't get it, you can have a look there. Otherwise, it's been published in 2005, the first edition of the Journal of Veterinary Dentistry. What it did is it looked at the level of evidence available for each product, with grade 1 being the highest and grade 4 being the lowest. So a grade 1 product, for example, Hills TD would be a good example. Royal Canin Dental Food is another one. They did properly designed randomized controlled studies in that particular species. So if they were looking at dogs, then they actually used dogs for that particular study, and then they proved that their product was actually favorable for, say, plaque reduction, and that's grade 1 evidence. If they got grade 2 evidence, then the study was done on the target animal, but it was either done in a laboratory or in a research setting, for example. Then grade 3 may not use the particular animal, so they might have looked at, say, rats, where they were, making a claim against dogs, for example. So that would be a lower level of evidence, which is a grade 3 level of evidence. And then the last level is just opinions. So someone who's respected gets up in a lecture and says, I like product X because it works in my clinic, or Joe Blow down the road says this particular product works very well. So that's the lowest level of evidence. So to start with, we have properly designed studies, which then could be put into the VOHC and get independent recommendations or acceptances, all the way down to just an individual opinion. So what's available and how do they work? So I thought what we'll do is we might spend the next 20 minutes or 25 minutes or so just looking at what's actually available from a home care point of view, and just looking at what's available in your particular clinic. And then after that, we'll look at some home care programs and what we do, and we'll look at a couple of videos. So when choosing products in our practice, we like to choose something that's going to provide a mechanical action and also a product that's going to provide a chemical action. So I'll split these two into the two categories. You've got mechanical and you've got chemical. So mechanical action literally means something that's going to rub or abrade against the tooth surface. As you can see here, toothbrushes, meat, for example, bones, abrasive diets, the chews, greenies, for example, and they'll actually physically abrade the plaque off the tooth surface. Then we have the chemical action products, so things like chlorhexidines, for example, zinc, ascorbic acid, the various polyphosphates and pyrophosphates, hexametaphosphates, the xylitol-based products, and the various oils and herbs, and obviously antibiotics. So these all fit into a product category which I've termed having a chemical action. So they don't abrade any plaque off the tooth, but they physically kill the bacteria or reduce the bacteria and the biofilm on the actual tooth surface. Lastly is a couple of products. There's one called Oravet, and there's another one called Senos. And both of these are sealants or waxes that are actually placed on the tooth surface by the veterinarian or by the owner. And what they do is they physically prevent the bacteria or the plaque from attaching to the tooth surface and preventing the biofilm from going subgingivally. So we'll have a look at those as well. So to start with, we'll go not necessarily from what I consider the best down to the worst, but we'll certainly start with one of the better ways of reducing plaque from the tooth surface. And this is toothbrushing. And we know that toothbrushing is very successful. It's used in humans on a regular basis. Most of us brush our teeth once or twice a day. I was just spending 10 minutes with my 4-year-old and my 5-year-old explaining to them the benefits of brushing their teeth, and we were standing in front of the mirror just like this little dog is here, and I was brushing their teeth for a couple of minutes just before we started this seminar, and I was explaining to them that, you know, using the toothbrush and putting some paste on the toothbrush reduces the amount of plaque on their teeth, and that stops their gums getting sore and infected, and then the bacteria won't spread to the rest of their body and they won't get sick. Because they always say, you know, Daddy, do I really need to brush my teeth? So sometimes it's a bit of a struggle. And I often think of them when I'm telling the client that they need to brush their pet's teeth as well, because when I brush my dog's teeth, I don't seem to have any issues. I just go up with the toothbrush and open their mouths and brush away the plaque. So the children in our household are probably very similar to the dogs or the cats in other people's households. You need a good explanation and a reason in your own mind to do it. So we know that toothbrushing is the most effective way of reducing plaque. As I said, there's some compliance difficulties, both in pets as well as children. Ideally, we should brush our teeth every day, and the reason why is because it takes plaque about 48 to 72 hours to mineralize into calculus, and it's quite difficult to reduce the calculus. Obviously, we need an anesthetic and scalers in order to do that. If we could get the owner to brush their pet's teeth every second day, for most animals, I think this would be quite adequate, because most pets already have healthy mouths, especially in the younger ones. We can add paste. Some pastes have various components in them to reduce some more plaque. Some are a bit more abrasive. Others have cyanate enzymes. Others may have other products as well. So brushing is the first way to do that. Ideally, we start as a puppy or a kitten. We recommend commencing by rubbing your finger against the gums and over the outside of the puppy and the kitten's mouth so they get used to handling their mouths. And this could take a week or more to do. We then might add some food onto the brush, and I'll show you a video of one of my nurses, Kate, doing this when we get to the end and we start talking about brushing in puppies and kittens. You can add something tasty to the brush, so there's some malt or molasses or some Vegemite if you're Australian. We then demonstrate to the client how to use the brush. It's always much more useful if you actually show the client how to brush, and it's also important to be very positive and have treats and rewards as well in order to get good compliance as well. And ideally, if you've got the whole clinic behind you and all of the nurses and all the vets are singing the same tune, then you're going to have a much better uptake. If the vet, for example, or the nurse within the consulting room recommends toothbrushing and shows how it's done, then the receptionist also recommends and reinforces it as well. Ideally, pets, like in the top picture, would brush their own teeth, but that's not going to happen. I have heard and seen in some of the zoos, some of the primates might brush their own teeth, but I don't think we'll get the dogs and cats doing that quite yet. There's numerous products on the market. The first and the best way to start brushing would be to use one of these puppy kits. Pedisan produce a very nice puppy kit, as you can see here, and on the person's pointing finger, they've got a microfiber cloth which can be used initially to rub plaque off the teeth, and you can add toothpaste to that if you want to, and then introduce a brush, and we'll have a look at that later on. The next in line, which I think work the best, are probably the foods. There's two foods which we recommend in the clinic, particularly Hills TD and also Royal Canin, and then the other tier foods like, say, Eukanuba and, say, Advance, for example. Some of the other Purinas might also work in say, the United States. Hills produce a food which is called TD. It was produced and brought out about 20 years ago now. It's available in both dog and cat sizes. It works on a parallel fiber technology, so that when the animal actually bites into it, and you can see it on the right-hand side of the slide there, it's a dry square-shaped kibble, and the fibers run parallel, so that when the dog or the cat's tooth physically bites into the food and penetrates into the food, it actually wipes away the plaque as the animal eats. We've found that it's best recommended to be given after dentals, as in after you've physically cleaned the teeth and assessed the animal's teeth, because we found in the early stages, early days, that if you were to feed it to animals that had loose or mobile teeth, they often would be extracted on the actual biscuit. So it's not recommended for animals that don't have a healthy mouth. It can also be recommended as a treat. It works quite well, we've found, in the clinic as a treat as well. It provides good plaque reduction when it's fed every second day, because it still reduces the plaque before it has time to turn into calculus. It has the VOHC seal recommendation, so it's been independently evaluated and shown to be an excellent diet, not only as a diet, but also a plaque and a tartar remover. And there's numerous, and when I say numerous, we're probably talking dozens and dozens of published studies now over the 20 years. Both Hills have a lot of data in-house, and there's also a lot of clinical data on this product as well. We've found ourselves clinically and also in some of the studies that we've also completed, that TD works really well on the teeth that actually chew, like brilliantly on the teeth that they actually chew on. It doesn't work as well on, say, the incisors and the canine teeth, because they don't actually physically penetrate or bite into those particular chews. And if you looked at a global sort of tooth score, you find that you still have some plaque and calculus on the teeth that aren't chewed or don't contact the biscuit, and there's almost no plaque and tartar on the teeth that actually chew the biscuit. So TD works very well for animals with healthy mouths, and also with a full complement of teeth in both dogs and cats. The Royal Canin diets came out after the TD diet. The feline diet was probably introduced about 10 years ago now, maybe 8 years ago now. It also has a parallel fiber technology for abrasion of plaque. It's got the VOHC seal, and there's also a number of published papers. I published one paper on the Royal Canin diet back in 2010, where we actually looked at the different sizes of kibbles available and their shapes, and also adding additives in cats. So we added two things to the Royal Canin diet. We added a polyphosphate, which was a crystal, a negative crystal, that we found that it bound to the calcium in the saliva and produced calcium products similar to calculus, so that the calculus didn't form on the animal's teeth. Uh, we also found that the polyphosphate inhibited mineralization of plaque into calculus as well, because there wasn't a significant amount of calcium in the actual mouth or in the saliva. Royal Canin also added a vitamin C analog, which they call the plaque-reducing nutrient, to the diet, and this acted as a plaque-reducing product in that it actually inhibited plaque attaching to the tooth surface, and therefore you got less plaque on the teeth. So it is an excellent diet both for dogs and cats. It's VOHC approved. There's numerous published papers on the diet as well. This particular product works similarly to TD in the fact that it has the parallel fiber, but it may, and I don't know whether there's any research on this, but I know clinically, even though I've already said that's a low form of evidence, but clinically I've found that this particular product works better than TD when the animal doesn't have as many teeth. So if they haven't got as many teeth to physically chew on and you don't get the abrasion, I would probably choose a Royal Canin diet over a TD diet. The other diets which we have available in Australia and New Zealand are Eukanuba and advanced diets. These both contain hexametaphosphate and the polyphosphates. As we said before, the phosphate crystals acts as calcium chelators, forming calcium phosphate and therefore reducing the amount of calculus available. They also have been shown in their studies to reduce the amount of plaque. The Eukanuba diets, I believe, came out before the advanced diets, but both claim good reductions in plaque and calculus. Onto some of the other products which are available. Greenies is a product which is available worldwide now. It acts by abrasion to clean some of the plaque and calculus off the tooth surface. They work well. They can be fed every day. Anecdotally, clinics and clients report they get very good reductions in plaque accumulation. They also have the VOHC seal. They've done independent research and studies which they've submitted and show that they actually work quite well. So Greenies is a good treat versus a lot of the other treats which you could buy from the supermarket which aren't so great. So Greenies is a product that we could recommend to clients to reduce plaque and calculus formation on the tooth surface. A lot of clients like to feed meat and bones. Anecdotally, there's not many published studies looking at meat and bones that are actually a controlled study, but there have been quite a number of studies to show that the raw meat reduces plaque on a tooth surface, like the abrasion of chewing meat. And I guess extrapolation and what would call just common sense would assume that if an animal is a prey animal and it kills another animal and eats it, you're going to reduce the plaque by abrasion as well. But there's not a lot of well-controlled studies in the literature to compare, say, meat and bones to not eating meat and bones. But there are a number. I did publish one study in the Australian Veterinary Journal back in, I think it was 1998, where we looked at feral cats, and they were eating native animals up in the Northern Territory, and we found that there was a reduction in plaque and calculus in their mouths, like a significant reduction in plaque and calculus in their mouths. But unfortunately, there was a lot of side effects as well. Some cats had bones caught in their mouths, penetrating into the soft tissues. The cats had a significant number of abraded and worn teeth and also fractured teeth, especially canines and upper fourth premolars. With pulp exposure, there was a significant amount of osteomyelitis in these particular cats as well. So even though they were feral cats eating a natural diet, and they did have reductions in plaque and calculus, so they did have improved periodontal disease, there's no doubt they had improved periodontal disease, they certainly didn't have healthy oral cavities. And I think this is reflected in the clinic as well. We see quite a number of animals that come into the clinic with bones caught over the hard palate. We see obstructions, diarrhea and constipation. And from a referral clinic point of view, we have a large number of animals with fractured teeth with pulp exposures requiring extractions or root canals. I would suggest that maybe 2/3 of the teeth that are fractured are the maxillary fourth premolars, with the first molar close behind. And in our clinic, about 60 to 70% of these fractures occur through animals eating bones. But I'd have to say in the last fortnight, it's been quite interesting because we've had a dog come in that the owner was freezing cow hooves and putting raw food into a cow hoof and then freezing it and giving the dog cow hooves, and that was fracturing their teeth. And interestingly enough, it's almost like deja vu, because 20 years ago when I was doing my residency with Dr. Wiggs in Dallas, the number one fracturer of teeth or breaker of teeth in dogs in Dallas, Texas was cow hooves. So 20 years later, they've now moved to Melbourne, Australia. And interestingly also this week, yesterday, we had a dog come in with 2 fractured upper fourth premolar teeth, and it was being fed antlers, as in deer antlers. So cow hooves and antlers certainly aren't good for teeth. And we've also, that would sort of fit in the same category as I guess the raw meat and the bones. So if the dog or the owner particularly likes raw meat, then our suggestion is to feed hearts, for example, pieces of meat like chicken or beef, chicken necks maybe. Large pieces of beef, maybe tails, bull's penises, long sort of stringy sort of pieces of meat as well. We've found reduce plaque, but don't break as many teeth. So that could be one of the answers. There's also a number of rinses, gels and water additives on the market as well. Chlorhexidine seems to be one of the most popular rinses. It's a product that's produced by a number of companies. Probably the one that's most common worldwide would be what's called Hexarinse, which is produced by the Verbac company. It's the most commonly recommended and used product, at least in this country, and I know in the United States. It's recommended to be used daily. It's very effective against plaque as an antibacterial agent. There's lots of research for chlorhexidine use in both the human literature as well as the veterinary literature. It would be probably the number one product for humans if you've got gingivitis or periodontitis and used by periodontists. We use it a lot in animals with severe gingivitis and stomatitis, those that have got, say, chronic ulcerative periodontal stomatitis, or like severe, say, kissing lesions, for example. Chlorhexidine works quite well for those when they're quite severe, or when you think you've got a spirochete-based infection, say the schnauzers and the poodles and some of those guys, so the more severe cases. I guess the biggest negative to this particular product of chlorhexidine is that clients don't like it because the teeth often turn brown in color. That's because the pellicle becomes discolored, and also we find it has quite a bit of taste. So the veterinary ones tend to have masking agents as well. But it's quite a good product post-dentistry if you've got quite severe gingivitis or stomatitis. Another product which is excellent is a product called MaxiGuard, which is made by the Addison Biological Company in the United States. This is more of a natural product than the chlorhexidine-based products because it contains vitamin C and zinc. Zinc has been shown to be antibacterial in a lot of the human literature, and there's a published paper in the veterinary literature. Vitamin C is also ingredient of MaxiGuard, and it's been shown in a lot of the human literature as well to stimulate collagen and have antioxidant scavenging properties. So between the two of them, it's quite useful for animals with gingivitis. We would use this particular product for animals, dogs or cats that come into the clinic as, say, puppies or kittens. If they want something which is a gel, because it's good for gingivitis. It's also very good for animals that have ulcerative stomatitis. So for example, the poodles, the greyhounds, the schnauzers that often have that kissing lesion on the buccal surface of the mucosa as well. And it's also quite good in reducing the plaque which accumulates on the teeth as well. So there's quite a number of published studies for both the chlorhexidine products and also the MaxiGuard, the vitamin C based products. They neither have VOHC approval, I believe. There's quite a lot of movement towards water additives. They've become quite popular in the last couple of years. There's many on the market, but the most common ones that we see are either the xylitol based products or the yucca and pomegranate based products. The xylitol product there's two on the market. One is called Aquadent, which is made by the Verbac company, and the other one is Breathalyzer, which is made by a Canadian company. Xylitol is a glucose type 6-ring sugar, and it irreversibly binds to the energy system in the bacteria, effectively killing the bacteria. Xylitol is very, very popular and common in a lot of the human toothpastes and chewing gums because xylitol is very good at reducing the bacteria that sit on a human tooth and cause a cavity. So xylitol is found in human chewing gums for that particular reason. And there's a lot of published studies showing it reduces plaque and cavities or caries in humans. So it's an excellent product in that regard. The downside to the xylitol product, though, is that xylitol causes significant hypoglycemia in dogs and cats to the point where if they were to drink enough of it, they would actually die. So it's not really a product that we recommend at this point because we believe that the downside to the xylitol products in pets outweighs the benefit in reducing any plaque that's in the animal's mouth. So I wouldn't be a fan of like the Aquadent or the breathalyzer type products. The other water additive is a product called Healthy Mouth, which is available worldwide. It contains natural ingredients such as yucca and pomegranate. It is added to the drinking water of both cats and dogs. Research shows that it reduces plaque significantly, statistically significantly, and it also has VOHC approval in both dogs and cats in various forms of dog and cat bottles as well. So it'd be worth going and having a look at the various products on that website. Another product which is sold here is called Plaque-Off. There's no studies that I'm aware of on Plaque-Off reducing plaque and making calculus porous. The claims by the company that calculus is more porous, so therefore it falls off the teeth and it reduces plaque accumulation, but I don't believe there's any published studies on this product. It's essentially a seaweed powder and you add it to the pet's food. It's available in both dog and cat varieties. The next two products are barriers or preventatives of plaque accumulation. Orovet is available in the United States. It used to be available in other countries as well. It may be possible to get it via the US. It's essentially a wax barrier and it's smeared on the tooth after the veterinarian has performed the dental clean. So the teeth are scaled and polished, remove all the plaque and calculus subgingivally and supragingivally, and this wax is then smeared over the tooth surface. And it attaches electrostatically and it repels the plaque from actually attaching to the tooth surface. And then the client applies the wax on a weekly basis and it lasts for around 3 to 4 months, I believe. There's a number of published papers to show that it works quite well. It's used and placed on with a little capsule attached to a gun, as you can see in the picture here. When it was available, I used it and I found that it worked quite well in schnauzers and poodles with the gingival recession and plaque was reduced, especially over root surfaces where there was gingival recession. I used to put it on, as you can see in the lower photo like that, just as a ribbon across all of the teeth, and then I used my finger or a prophy cup to actually attach it to the tooth surface. There's a number of published papers and to recommend that product actually works as well. There's various chews on the market. There's some published papers to show that some of the chews are quite effective in reducing plaque. Some of them have thiocyanate enzymes, for example, the CET range of chews. Verbac have brought out a vegetable chew, which has a chemical and abrasive nature as well. And these have research to show that they reduce some plaque and calculus. And there's a number of papers which you can hunt out and see whether they're to your liking. The last sealant, similar to the Orovet product, is called Sanos. Sanos is a polymer which is painted onto the tooth crown and subgingival area and gingiva after the teeth have been scaled and polished. It's designed as a liquid polyvinyl polymer that seals the gingival sulcus, and what occurs is that the plaque doesn't penetrate through the seal, so it can't go subgingivally or can't travel subgingivally, so therefore you get less subgingival plaque and therefore you get less gingivitis. It also has a capability, and it's engineered to allow oxygen to travel subgingivally and water to travel subgingivally, and also it allows the crevicular fluid that's produced from the subgingival areas to travel through the sealant as well. Once it's painted on the tooth and gingival surfaces, it lasts for 6 months. It does have VOHC approval, and it's been published. It has published papers in the Journal of Veterinary Dentistry. I've used this. It's only a relatively new product. I've been using this for about 12 months now. I find it's very successful and useful in cats especially, and also toy breed dogs, especially the smaller ones, such as Yorkies, Poodles, Scotties, and some of the other smaller breed dogs, in reducing plaque buildup as well. So it's a product that I would recommend as well. So as you can see, there's a large number of products on the market that are available to the veterinarian and the veterinary nurse in the clinic. So when you look at these particular products, I would recommend you go and have a look at the Veterinary Oral Health Council website and just see whether the product has independent research and independent recommendations. If you want to go a little bit further, you would then have a look at the product and see what papers have been published on it as well. If you can't get the papers yourself, you're more than welcome to ask me or get me to send you some of the papers, or you could ask the representative from the company that makes it to provide the literature and the papers as well. So that would be another way of doing that. And then you need to obviously choose a product that's going to work on that particular animal and also for that client. So we've split up the home care programs into a number of areas. The first one really is puppies and kittens, because I think this is when you could really start a home care program. And at the clinic, what we do on the initial visit is discuss general health with the owner, but we also discuss deciduous teeth and permanent teeth. And we open the animal's mouth and I show them and discuss the types of teeth. So I say this is an incisor, this is a canine, and this is a premolar tooth. These will be replaced by permanent teeth. We explain that the plaque will attach. Plaque is bacteria and will attach to the tooth surface, and if it's not removed, it will form gingivitis and then form periodontitis and periodontal disease. And not only does it have a local effect in the mouth, but it will also spread systemically, causing liver and kidney disease. So it's important to the owner to remove the plaque and have the animal remove plaque from its teeth. So then we talk to them about home care, and we say, the best way to remove plaque, as you know, because you do it yourself, is to use a toothbrush. And we demonstrate toothbrushing at this time on a model rather than on their pet. And we explain and show them how you handle the mouth. So how you open the mouth by lifting up the lip, how you can push your finger down the side of the mouth and into the back of the mouth without getting bitten. We then suggest to them that once you've handled the animal's mouth for about a week, we can then move to the finger cloth. And then once you've moved for the finger cloth, you can then hopefully get to a brush. And then what we do is we say, well, there's a video here which you can watch, and this is Kate explaining how to introduce brushing. So there's two videos which I'll show you now. The first one is a client with her daughter and her dog that's got relatively clean teeth, doesn't have a huge amount of periodontitis or gingivitis. The owner's quite keen to learn how to brush the teeth. And what she's going to talk to them about is how to brush teeth. So I'll just let you look at this for a few minutes. Okay, so what we can see then is that between the dog and the client and the nurse, they started to introduce the actual finger brush. So then the client then takes the finger brush home, and then we're going to catch up with them again a month later. Excellent. So what we then will do with clients is we'll then check them on a monthly basis. So the client and the dog will come back on a monthly basis until they get the hang of the toothbrushing. And we found that with puppies and also with kittens, the same principle applies with kittens. But if you follow that example that we've just shown then with the month apart demonstrations, you'll find that the majority of animals and also clients will get the hang of toothbrushing. So that's a perfect way to introduce toothbrushing into the practice, whether they be for puppies or whether they even be for animals that have had surgery. So that's ideal for puppies and kittens. The next category, I guess, is the animal, the dog or the cat that's come in and they've already got plaque and calculus on their teeth. So after they've been discharged, what we will do is our nurses will actually do the explaining, and they explain the procedure which was performed. Uh, Plaque and calculus has been removed from the tooth surface. We then ask the client if they've got any questions. Invariably they do. They then get answered. We then inform them that the plaque and calculus has been removed, but it needs to be continually removed in order to keep a healthy mouth. And we then show and explain to the client some of the home care products that are available, basically the same ones that we've discussed over the last 45 minutes. And we then ask them, do they have any issues with trying to brush? And most clients, we will say, oh no, I'm happy to try, or they say there's no way that the dog will let me brush the teeth, for example. So what we do is we then discharge them and we give them the pack, the finger brush, as you saw, the toothbrush and paste, and we show them that first video and we say, can you just handle your pet's mouth and introduce the finger brush until the revisit in the next week? And we always check every patient after an anesthetic after a week. So then we can see whether they've had any issues. So effectively their homework over the next week is to handle the outside of the pet's mouth, as you saw Kate showing the client there, and then we get a feedback in a week as to how they went. Animals that had extractions are slightly different. We still explain the procedure and we show them the home care products that are available and ask them whether they're keen to brush. But in our clinic, we suture all of our extraction sites closed. So the suture's in the actual mouth. So we don't want them eating hard food because we don't want the sutures to break. So we advise them to feed chunks of meat or softer foods and then show them the video as well. So they get an idea of what toothbrushing is going to be like. But we tend to discharge them with the Royal Canin food or TD food. In my practice, we recommend Royal Canin as our preferred food. The reason why we do that is, as I said previously, is because it has both the polyphosphates as well as the vitamin C and the plaque technology, and I think it does a better overall job of reducing plaque over the entire mouth than some of the other foods. We then discharge the animals with either a rinse or a gel, so they either go home with Hexarinse or MaxiGuard, depending on the type of animal. So if it's a cat, they always get MaxiGuard. If it's a dog, if they've got gingivitis, they get MaxiGuard. If it's a dog that has quite severe periodontitis, they get Hexarinse. We then ask them to come back in a week, or 2 weeks, maybe 7 to 10 days, and we check and see how the sutures are, whether the sockets have healed. If they have, we then discuss brushing again. We show them that first video and we get them to go through the same process, handling the pet's mouth with a finger brush, and then we get them back in another 10 days to see how they're coping. The animals that come back for the 7 to 10 day check to discuss the home care and the toothbrushing, and we always talk about the various options. So we talk about food, we talk about toothbrushing, we talk about rinses and gels. And we also check for plaque accumulation, which is worth doing in your clinic as well. And you can use 2 products. There's one which is called erythrocin, which is quite common on the market. You can buy it as a liquid called plaque disclosing solution, and you just put a drop into the pet's mouth and it will stain plaque a pink to red color. So the picture on the lower left hand side of this slide, you can see the really red areas have quite dense plaque and quite a large amount of plaque, and the pinker areas have less plaque, and the white teeth there's no plaque. This is a really good indicator of how well a client is brushing the teeth or how well your home care product is working. So if the animal goes home and 30 days later you put the plaque disclosing solution in and there's erythrocin all over the mouth, either the owner hasn't been able to use the product, or the pet hasn't accepted the product, or the product just has not worked. Now, the downside to using erythrocin is that your white dogs will become pink, and some clients don't like the fact that their white dogs have a pink stain. So the other product you could use is fluorescin. It's the same fluorescin dye that a vet clinic would use for checking an eye ulcer. So you can use a fluorescin strip, or you can buy fluorescin dye as a liquid, and you put that into the pet's mouth, and then you shine your ultraviolet light in the pet's mouth, and you'll see the fluorescence. As you can see on the picture on the right hand side, you can see the fluorescent dye where the plaque is. So this is another way of showing clients whether their home care products are working as well. We then prepare the clients for ongoing checks. If the owners are finding it too difficult to use 2 products, or if we're finding that the client just isn't getting success with one product, then we'll swap them to another one and try and show compliance. And then we get the animals back generally in 3 months, 6 months, or 12 months. So owners that are finding it really difficult still maintain their monthly checks, but those that are on hand and coping quite well with toothbrushing, or if the food is going really well and you're finding that there's less and less plaque in the mouth, the gingivitis is being maintained at the same level or improving, then you could stretch out your checks to either 3 months, 6 months, or 12 months. So that's essentially how we do it in our practice. So I've tried tonight to show you the aims and the reasons why you'd want to set up a dental home care program in order to reduce plaque in a pet's mouth and give them a healthier oral cavity and in turn a more systemic health. We looked at the different ways of choosing a product. So my primary goal would be to get you to go onto the vohc.org website and see whether the product has a VOHC claim. If it does, then that's fantastic. If it doesn't, you could then check the literature and see whether there's any articles or papers for that particular product and see what the literature says as well. We looked at all the various products, about a dozen or more products that are available, looked at some of the benefits and how they worked, and then finally we looked at the various home care programs and when to start them. Puppies and kittens, animals that have just had their teeth cleaned, and those that have had extractions, and also how to monitor and prepare the client and also yourself and to prove that the actual plaque is being reduced. So the plaque is being reduced, the client is doing the actual home care program, the patient is accepting it, and the product is actually working by checking on erythrocin and fluorescein levels. So that's how to set up a home care program within your clinics. These pictures, the presentation, both verbally and visually, will be available on our website, vdec.com.au, so the Veterinary Dental Education Centre, vdec.com.au. I'll also make available our nurse videos with the client as well. And thank you for attending, and thank you, and I hope you enjoyed it. Thank you.